This video is intended to help your clinical reasoning by developing a diagnostic framework for vomiting, particularly in pediatrics. This should hopefully make it easier to consider differential diagnoses in a more structured way. Let's start off with a case-based scenario. Imagine you're the resident in the paediatric emergency department of a busy tertiary hospital in Sydney. It's your first paediatric rotation as a junior doctor. A 9-month-old boy presents with a 24-hour history of colicky abdominal pain, anorexia, fever, and progressive lethargy. The infant seems to be in pain and is intermittently drawing his knees to his chest. He's been vomiting yellow material, which has just started to turn green. Your heart drops and your skin turns pale. The third coffee you had this morning is starting to make you feel the palpitations you've actually just been ignoring since the second one at 8. And you realize the lack of pediatric revision since 4th year of med school is coming back to bite you. Instantly, a deep thrill of regret for not learning about the differentials of bowel obstruction hits you harder than the foul smell of bilious vomit on your new destroyed brown chestnut RMs that you've been saving up for. Thinking back to when you learnt about the complicated pathophys of the emetic reflex and the chemoreceptor trigger zone in the medulla oblongata, you realize this presentation might just be too time sensitive, and you think about this video and remember there are about 6 pathophysiological ways that you might need to emesis and just present to the ED in your poor mother's arms at the age of 9 months. A good way to remember these categories as a differential framework is with the mnemonic vomit metabolic acid. This stands for vestibular, metabolic, anatomical, CNS, infectious, and drug-related causes of vomiting. There are a number of vestibular causes. From out to in, they might include otitis media, benign paroxysmal positional vertigo, and motion sickness. It's clearly not the most likely differential in this case, but it's certainly something to keep in mind for next time. You should also think about metabolic causes like diabetic ketoacidosis and electrolyte imbalances like hyponatremia. Anatomical causes of obstruction in the GI tract include things like pyloric stenosis. Remember, that's the one with the 3 Ps, projectile vomiting, a palpable mass, and peristalsis that's visible. Or Meckel's diverticulum, and that's the one that loves the number 2. It affects 2% of the population, 2% asymptomatic, it's 2 inches long, it can have 2 types of mucosal tissue, and it presents at the age of 2. The central nervous system can also cause vomiting from an injury like a concussion, or anything that just causes an increase in intracranial pressure like a bleed or tumor. Infections can also cause vomiting, but don't just think about gastroenteritis, also consider sepsis. Break down infections into viral, bacterial, fungal, and parasitic infections. Drugs are an obvious cause of nausea and vomiting, but I'm not suggesting that this 9-year-old is partaking in some illicit back alley activity. We can imagine that this infant has accidentally taken a particular interest in that delicious cowpole that was left out. This diagnostic framework isn't perfect, and it's not the only way you can think about differentials. You might instead think about a purely systems-based approach. The other thing to consider when you do form a set of differentials is that it's an iterative process that dynamically needs to reflect new bits of information you might not have had at the original presentation. To review what we've gone through today, differential frameworks can help you with a structured approach so you don't miss some major conditions. They can be generated using different strategies like a systems-based approach or a mechanistic approach. One mechanistic approach to vomiting might be remembered with the mnemonic vomit metabolic acid. Finally, forming differentials is an iterative process. Thank you for watching Townsend Teachings. Don't forget to hit the notification bell and like, comment, subscribe.